Hello, I am Tanmay Mehta, and today I am going to present about Limflow system, revolutionizing limb salvage. Now, talking about the main problem here, before coming towards Limflow system, the main problem here is chronic limb threatening ischemia, that is CLTI. Typically, that's a chronic condition where there is lack of blood flow to the leg, typically due to blockage or narrowing of arteries, which leads to chronic pain, typically increased risk of mortality, risk of amputation, loss of sensation, and many other symptoms. As we know that CLTI is an advanced form of PAD, that is peripheral artery disease. As shown in the figure, we can see that there is non-healing ulcer, gangrene, and a plaque-like condition which is leading to narrowing of atherosclerotic artery, leading to ischemic foot. Now, what is the solution? The main problem here is the risk of amputation, and that is because of lack of blood flow. So we are going to redirect the blood flow towards the foot using veins. So arterialization of veins is the solution. As mentioned in the diagram here, you can see that the blocked artery blood flow is redirected into the vein, leading to arterialization of deep veins, and that is achieved by Limflow system. Limflow system, transcatheter arterialization of deep veins is the typically used to treat CLTI. Talking about components, it has four basic components: arterial catheter, venous catheter, and two types of stents, crossing and extension stent. So arterial catheter and venous catheter both are ultrasound guided, and they are made up of polyurethane or silicone. These are used because they are biocompatible in nature. Our typical valvulotome is a surgical blade made up of titanium, and the main role of valvulotome is to make the vein valves incompetent so that we can achieve reversal of blood flow, so that we can supply oxygenated blood through the vein to the ischemic foot, leading to treatment. The stent has two parts, core and covering. The core is made up of an alloy which has shape memory properties, that is nickel and titanium alloy, and the covering stent is made up of polytetrafluoroethylene which has self-expanding property. It's a porous and biocompatible polymer. So talking about procedure here, so initially the venous access is achieved, and there is insertion of venous catheter up to the intended crossing point, and then after the arterial access is achieved, there is insertion of arterial catheter. The venous catheter and the arterial catheter both are aligned at a position with the help of ultrasound guidance. Nextly, a thread goes from arterial catheter into the veins, leading to a connection, and after that angioplasty balloon is used to dilate the connection. Next, the valvulotome, which is a surgical blade, is used to render the valves incompetent, leading to reversal of blood flow. And lastly, there is stent which comes into picture, which creates a permanent connection between the blocked artery and the vein, leading to redirection or bypass of the blood flow. This video is going to explain how does the process occur. There is pre-dilatation. After that, the valvulotome is going to render valves incompetent, and you can see there is a tapered stent which creates a permanent conduit, which leads to a redirection of blood flow, leading to arterialization of veins. So these are some key benefits mentioned here. Lastly, the lymph flow system is typically designed to restore the blood flow in the ischemic foot. Due to this, there is supply of oxygenated blood to the foot, and which leads to wound healing and decrease the risk of amputation. Thank you.